B12 deficiency is a common cause of falls. B12 is critical to the functioning of the nervous system. What we see with falls is that the nerves in the lower part of the body are affected from a lack of B12. These nerves have an insulating coating known as the myelin sheath, and with B12 deficiency, this myelin sheath gets damaged in a manner somewhat similar to the fraying of an electrical wire, making it harder for nerve cells to carry messages. As a result, victims often develop weakness, balance problems, leg and back pains, or numbness in their hands and feet. Many victims walk with a slow foot slapping gait because they can't tell when the bottoms of their feet are touching the floor. B12 deficiency can cause visual disturbances, vision loss, dizziness, vertigo, and postural hypotension, a sudden drop in blood pressure upon standing. Together, these problems dramatically increase the risk of falls, leading to broken bones, expensive hospital stays, and often an end to an independent life. Meet Arthur. Arthur came to our emergency department with a nasty gash on his head. He said that he felt weak and had trouble walking. Unfortunately, it wasn't Arthur's first visit. The 73-year-old's chart showed a history of multiple falls over the past 3 weeks. After hospitalizing him and running tests to rule out a stroke, the doctors sent Arthur home. He returned 5 weeks later complaining of weakness, and the doctors discharged him after a short stay. 9 weeks later, Arthur returned after a fainting episode, resulting in a severe fall that caused him injury. By this point, his family considered selling Arthur's home and having him move in with them, an action he dreaded. But this time, an alert doctor ordered a serum B12 test, resulting in a diagnosis of B12 deficiency. The doctor started Arthur immediately on B12 therapy. Thanks to this doctor's willingness to spend time investigating, Arthur finally received an actual diagnosis of B12 deficiency. With B12 treatment, replenishing his levels of vitamin B12 will likely clear up his weakness completely, leading to improved health and less hospital visits. His chronic falls will become a thing of the past, allowing him to remain independent and keep his home. Often, as in Arthur's case, older people's falls stem from problems with standing and walking. A typical case involving a 61-year-old shows how easy it is to correct these symptoms if they originate from B12 deficiency being detected early enough. This patient began experiencing numbness and tingling in his toes, gradually spreading throughout his feet. Finally, the tingling turned into pain and weakness, and by the time he came to the hospital 6 months later, he could barely walk with assistance in the daytime, and he couldn't walk at all at night. Unfortunately, this is a common problem for patients with neurological issues, because when it's dark, they can't use their vision to compensate for the impaired sensory input from their feet and legs. After quickly identifying this patient's B12 deficiency, his new doctor immediately started him on vitamin B12 injections. As a result, his tone, strength, and reflexes improved within 2 weeks. Within a month, he could walk normally again. In some cases, motor problems so severe that they cause near paralysis can be reversed within a few months. These results are common when doctors catch B12 deficiency in its early stages. But because vitamin B12 deficiencies are commonly overlooked by doctors, too many patients are needlessly suffering. Often, people who can barely walk a few feet can resume daily chores, drive, and even exercise again within a few months of starting treatment. Equally important, many can live independently without the constant fear of becoming victims of crippling falls that could rob them of their independence. The benefits to patients are obvious, but there are enormous benefits for the medical system and insurers too. From a financial standpoint, The cost of a fall and resulting fracture, admission, X-rays, labs, CT scans, casting, possible surgery, physical therapy, medications, a visiting nurse, and possible placement in an extended care facility far exceeds the cost of a B12 test and therapy. We find it perplexing that hospitals do not routinely provide B12 screening for patients suffering from weakness or repeated falls, mainly because the diagnostic procedures that hospitals order for these patients are expensive. For example, patients with these symptoms almost always receive a brain CT scan, costing approximately $1,000, and each time they return, they receive additional scans with additional costs. We do not quarrel with ordering expensive CT scans, which can reveal problems other than B12 deficiency, although they're useless for diagnosing low B12. Instead, we have a problem with medical professionals who fail to order necessary and far less expensive B12 tests. I'm not saying that all falls stem from B12 deficiency, but statistics suggest that a significant percentage do. Doctors should always test B12 levels when an older patient complains of pain, numbness, weakness, dizziness, difficulty walking or falls. Also, nurses and directors of healthcare facilities need to stand up for their patients and advocate for proper screening, diagnosis, and treatment. A B12 deficiency is serious. By not testing B12 levels, many more seniors, young adults, and children will succumb to health issues and disabilities that could have been prevented by a simple B12 test. This can save billions of dollars in healthcare costs while protecting and preserving life.